Director of Department on Disability Services. So I will go ahead, as we always do, and start with the data. The good news is the report that I'm giving is the same report we've given for the last 2 weeks. I'm very happy to say. So in the month of May, we had only one COVID infection, and that was at the beginning of the month of May. And thus far in June, we've had none. Overall, there have been 429 people supported by DDA who've contracted COVID. Of those people, 9 were in host home settings, 114 in intermediate care facilities, 1 was in a mental health facility, 56 were in their natural homes, 2 in nursing homes, 4 in out-of-state placements, 37 in residential habilitation, and 206 in supported living. So the 114 people in ICFs represent about 38% of people who are supported in ICFs who've contracted COVID. Of those, 10.5% or 12 were confirmed as having died from COVID. There were an additional 11 deaths, which either have been confirmed as not COVID or for which we don't yet have the cause of death. In natural homes, the 56 people represent 6% of the people in natural homes who have contracted COVID. And of those, 5 have died and all are confirmed as COVID deaths. In residential habilitation, the 37 people represent about 34% of people in residential habilitation placements. Of those, there are 2 confirmed COVID deaths representing 5.4%. And there was 1 additional person who died, but that was either confirmed as not COVID or not yet determined the cause of death. In supported living, there were the 206 people represent about 22% of people in supported living. Of those, there have been 15 confirmed COVID deaths, representing a little over 7% of the people with COVID in supported living. And there were an additional 6 people who did die, but those either the cause of death was confirmed as not COVID or it has not yet been determined. So overall, of the people supported by DDA, the 429 people represent about 18% of people supported by DDA. Of those people, 36 have had confirmed COVID deaths, representing a little over 8%. And there have been an additional 20 deaths, some of which have been confirmed as not COVID, and others for which we are still awaiting the cause of death from the Office of Medical Examiner. By placement type, as indicated, our major placement types: ICF, residential habilitation, supported living, and natural homes. There have been no cases since April. The 1 case that we had in May was in a host home. People requiring hospitalization who have contracted COVID. The last time was in April. There was 1 person, and there are currently no people hospitalized. As I indicated, there have been, of the people who have contracted COVID, 56 have died. Of those, however, 12 were confirmed as not COVID related, and we are still awaiting the cause of death on 8 people. So there have been 36 people who had a confirmed COVID death. And those confirmed deaths, we've not had a confirmed COVID death since March. Among provider staff, I'm happy to say we also have no update this week. There have been 696 provider staff who've tested positive. 51 of these staff work for more than 1 provider, and 10 staff have died from COVID. Now, as it relates to vaccination, um, that's interesting. So there's a question in the chat. The coronavirus website shows 57 deaths as of June the 2nd. Um, I will look into that, but I always, when the person dies, I always check our list to see if it was someone who had previously had COVID, and I'm not aware that we have added a person. I could be mistaken there, but we'll look into that. Winslow may respond while we're meeting. He could respond by email with the data, the specific data. So as of our reports yesterday for the people that we support, things are moving along. Still, they change a little bit every week. So overall, with the people that we support, 73% have been vaccinated for COVID. Within the folks who are in placements, we're doing fairly well. That's overall over 80%. So in ICFs, we have 96%. In residential habilitation, 92%. People in supported living are at 82%. In people in other placements, it's a variety of different placements. There's 65%. Host home is at 70%. And natural home is at 55%, which the 55% had concerned me. However, when I look at the data for the city, it tracks pretty closely to what the city is looking like. And so, as a city, we're, I think, fully vaccinated is at 42 or 43%, and at least one vaccine is a little over 50%. And then among provider staff, we are now staff who've been fully vaccinated at 51%. And I'll also just let people know that this week within the district government, we were informed by DCHR that there's a request that has gone out to all district government employees to report their vaccination status prior to, as I've reported before, all district government employees will be returning from telework July the 12th. And so the district is requesting that all of those employees enter either that they've not been vaccinated or partially vaccinated or fully vaccinated prior to their return on July 12th. And I believe we'll be getting that data by agency, so we'll be able to report that aggregate data on our agency as well. And just so people are aware, we do not get the staff-specific data. So there's a question, how does the current percentage for staff vaccinations rate vary by provider? Significantly, from 0% actually, which, and unfortunately. So if you're talking about by provider, but for staff, it goes from 0% up to 100%. And there's actually, if I look at the data in terms of providers who are above that 70% mark, which people seem to be aiming for in terms of, have really reducing the possibility of community spread. So we have 29 providers who are reporting 70% or better. And that is out of 91 providers. So about 30% that are reporting a rate that is an excellent rate, an excellent vaccination rate. But as I said, it really runs the gamut from some providers where there is pretty low. I mean, 0%, obviously very low. Providers who are under 25% of their staff right now only represent 5 of our providers. Of those who are, wait a minute, let me make sure that's correct. Oops, sorry. 8 of our providers. And then so for the people that we support, the range is similar to that, although there are far fewer folks. Yeah, the providers we have where there are really low numbers of the people they support tend for the most part to be providers that we're reporting on all. My list has all providers, so it's of all services, and so they might not be reporting the people. The folks that upload the data are the residential and the day providers. Ah, so apparently this is my mistake, and we did need to update our data. So I will have the updated data, including the kind of placement the person was in. There was a person who died on May the 31st, which was a person who had had COVID previously. Um, and so we should be updating that there are 57. Doesn't change the number of people who are confirmed COVID deaths, however. I'm sorry that I didn't catch that when I was updating my data. How does the current percentage for staff? Oh, I just answered that, I believe. Um, shouldn't providers aim for a higher vaccination rate given the nature of the work and the population they're working with? That feels rhetorical. Yes. Um, we should be aiming for 100%. There should be and I know that one of our providers that implemented a requirement that all their staff get vaccinated had, of course, an exception for staff in situations where there was a medical reason not to be vaccinated. That provider rounds up to having 100% of their staff vaccinated. I know that they had a very small, maybe one person who could not be vaccinated. Um, absolutely. Um, at one point, I believe you indicated that it might be possible to publicize staff vaccination rates by providers. Can that happen? Yes. And my understanding is that it will be happening starting on Monday. We will be publishing that so that as people are making decisions regarding placement, to the extent regarding like day services that they wish to return to the extent people wish to consider the providers success with having their staff be vaccinated, they will have that data available to them to be able to consider. Are all providers required to report to DDS on their staff vaccination rates? Yes, they are. The staff vaccination information will be published on our website. I assume with our other, maybe if Kirk is here, he could say exactly where it will be on the website.
Good afternoon, everyone. We will be publishing it on the main website. So it'll be on the main homepage. The link is kind of being worked out right now, but it will be posted on the main site.
And I honestly think the most important will be that the teams that are helping people decide on services have access to that, that they will also be getting that information, that they have the access, so that, as I say, to the extent someone wants to use that information as they make their decision, that it'll be readily available to them, because it will be going out to all of our staff on Monday as well, all of our staff that need it in terms of service coordination. Did the provider that made staff vaccinations mandatory have a problem of staff resigning? I don't believe so. I do believe that they had some staff choose to leave rather than get vaccinated, but I don't believe, and they could type in if I'm mistaken, that ultimately they had any staffing issues. And I want to say, and it's important to emphasize, they didn't just say you must get vaccinated. They made a real effort at educating people, at answering people's questions. They had a number of sessions with their staff so that staff would understand what the vaccination was about before implementing a mandate that the staff be vaccinated. So, it wasn't simply a requirement. It was a requirement along with some substantial education, which I think ultimately, which we can see from the data, because not only for their staff, but also for the people they support, they're up at 99 point some percent in both instances. Yeah, and just confirming from that agency, they did not have staffing issues. They made a cultural shift as an agency and provided lots of education. We agree, and we did ask that. There's a comment, they should work with other agencies, absolutely. And we did have, at one of our provider leadership meetings, we had different providers share the strategies that they had used to encourage vaccination within their agencies. Yeah, they did a fantastic job. And I do want to emphasize lots of education. Are all providers complying with the requirement to report staff vaccination rates? I think there are still some holdouts, but I'm going to defer to Kirk on that and the steps that are being taken with those providers that are not reporting.
I'm sorry, can you repeat the question, Director Reese? I cut out on my end for a bit.
Are all providers complying with the requirement to report staff vaccination rates? And I just said I would defer to you. I thought there were some that were holding out, and that I was deferring to you on that and the steps that are being taken to
There are three
encourage
providers.
compliance.
There are three providers that have not reported, and we are frequently checking in with them to figure out what is the reason. After that, we are starting to contemplate sanctions and other possible remedies that we have at our disposal. But right now, we're not taking any actions other than trying to really help them figure out what's next in the vaccination, in their vaccination goals, and also try to figure out why they have trouble reporting.
Yeah, we've also been reaching out to the providers whose performance has been lower to talk with them about what strategies they've used, what plans they have, what supports they need to improve their performance. You see the request from Daryl? And just from someone, for people who are on the phone and can't see the chat, thanks to Holistic for self-identifying. We hope that you can set the example for others. People may recall Holistic presented very early on in the pandemic about the strategies they had to prevent transmission as well before we had a vaccine. I think they've been very proactive throughout, and have set an example for others. Holistic is just thanking DDS and DC Health for their support, um, which, I mean, I certainly do have to agree that from my perspective, DC Health has worked very closely with DDS and our providers to address this pandemic for the last, was 14, 15 months. That has gone on far longer than any of us anticipated, I think. Are there any updates on the Appendix K? I'm sorry, I shouldn't laugh about that. For people who dealt with CMS, you would understand that. We have answered all of CMS's questions. They asked a new one that's got us a little bit baffled regarding companion services. And we have a conference call scheduled with them next week, I think it is, to try and address the latest questions that they have. It feels as though perhaps there's a new team that is reviewing this, because they're reviewing things that have been in the Appendix K from the beginning. When will DC Health provide a discussion on the new visitation guidance for ICFs and SL? I thought they did, but perhaps Nelson or Daryl can address that. I thought that DC Health had provided, had done a presentation on their latest updates, but Daryl and Nelson?
Hi, Director Reese. I think we'll go ahead and yes, we have, and it is posted on our website. So, but if the querent can ask a specific question, we're happy to ask any, answer any of specific questions on the invitation guidance. The link to in the chat for that specific guidance for reference for the providers on that line.
And for people who do, which I hope you do, that's a good one right there. So for people who do visit the website, you will see that there's been significant changes in the guidance. And perhaps Nelson or Daryl can address that, which I think will also address the question that I see in the chat. Is there an estimated time on updated guidance from DC Health for day providers?
I'll defer to my colleague Nelson, who's on the guidance team, to answer that one, if he's available. If not, I can try to provide some guidance on the day program.
He's on mute.
Hi, sorry, I was having trouble unmuting. There actually is not going to be additional guidance released for day providers from DC Health. DC Health is moving more towards, collaboration with certain settings, and adult day programs is one of them. We're continuing to provide guidance for our long-term care settings, our ICF, CRF, supported living, and settings like that. However, we are treating day programs more as a business in that sense, because most of them are not licensed by DC Health, and so they're going to be referring to the business guidance that has posted in those guidelines that are on coronavirus.dc.gov, and we will hopefully be collaborating as necessary with DACL and DDS as needed to provide guidance and review any documents that they would like us to review related to reopening of day programs or continued opening of day programs.
And just to follow up on that, as a reminder to people, there is the best practice guide on DDS's website that is actually still current, because kudos to the group that developed that guide. They did links to the CDC and DC Health, and those links actually update in the guidance. So when you read the guidance, it will link to the most current health information. The limitation on number of people in a setting for day programs was in the DDS phase 2 guidance that I pretty sure I had told people is no longer on our website. Given all of the changes that were made regarding phase 2, we took down that particular guidance because there's been so much that has happened since that was posted last summer. And so, as Nelson said, what you really need to look to is the guidance that's there for running any business. And, that's the kind of thing that as people are making decisions about programs they go to, each program's decisions about how they ensure the health and safety of the people they support will play a part in people making those decisions. And so each of our day providers has reopening plans of their own, and that's the way it'll need to work. If for those of you, and I expect it's now most of us who are out and about in the community, it's the way most businesses work now, where you check out as you go in what their rules are. When I go to the cafe across the street, if you're fully vaccinated, you don't need a mask. When I go to the pharmacy, I have to have my mask available. So the rules do differ by business. There are the health guidelines that serve as sort of the floor, and then every business can choose to impose greater restrictions if they choose. Yeah.
Just quickly, I just wanted to point out to those that have joined via computer that my colleague from DC Health, Andrea Coker, sent the link to the ICF indoor visitation guidance, and we'll be posting the link to the SL guidance, which is found in the supported living and CRF guidance as well. For those that joined via phone, all of our guidances are found on coronaviruses.dc.gov under health guidances. Thanks.
So Nicole Preston has provided an update regarding Special Olympics. They're hosting a vaccination information webinar with Children's National Medical Center on Tuesday, June the 8th at 6 p.m. for any athletes and their families who aren't vaccinated yet. There is a flyer. With infection and death rates higher in the Black communities in DC, we have two healthcare professionals from minority communities leading the webinar, as well as two of the athletes from Special Olympics to share their experience getting vaccinated. They'll be open so that attendees can ask their questions in a welcoming space. It will be followed up with a vaccination clinic at the River Terrace Educational Campus on Tuesday, June 15th. For people with intellectual disabilities, their families, and anyone in the community. These events are also registered. Sorry, every time a new one comes in, it like resets and moves it. These events are also registered with the White House Month of Action vaccination campaign to get 70% of U.S. adults vaccinated by July the 4th, and that is launching this weekend. There's a question. I'm sorry if I missed this. What's the purpose of publishing vaccination rates on the DDS website? It's to make, is it to help make informed choice of day services or to encourage more staff and providers to receive vaccinations? The purpose is to make the information available so that people can have it, so that they can, as I said, for people who wish to consider that in making their decision, that they have that information available to them. So Special Olympics love to have as many people participate in the webinar as possible, particularly those who have vaccine hesitancy. If there are any questions, please contact Special Olympics, Nicole Preston at 202-708-2644. If day programs are a DC business, is it safe to say there is no 10-person spacing / capacity limitation now? Correct. The only place where the limitation was indicated was in the DDS guidance, which, as I said, was taken down after all the changes came about with phase 2. So DC Health never had a specific limitation. What the best practice guide does is refers people to the CDC and DC Health so that you can consult best practices to ensure that you're providing services in a safe. It says, can we get something in writing besides the comments in this meeting that confirms that day providers should simply follow business COVID standards? I would rely on the mayor's orders. Are there any specific provisions being made in the mayor's budget to address mental health impacts from the COVID crisis beyond the DBH policing alternatives? Quite frankly, that's a DBH question, and they're not here with us. I noticed host home did not come often in Appendix K. For instance, Appendix K allows virtual monitoring for services like SL. Virtual monitoring was a problem during PCR for many providers who were trying to apply the same to host home. Could that be included in any upcoming revision? Well, the services in a host home are provided by the person who lives there, is my understanding, and perhaps Winslow could address this more thoroughly than I could, but my understanding is that host home services are like, adult foster care. They're provided by the person who lives in the home, so remote services would really not be appropriate. But
That's absolutely correct, Director Reese. And if the person who asked this question needs to have a further discussion, I can be reached at 202-730-1618. And I am in the office today. So maybe I can get a little more clarity on the nature of the question, but you're absolutely right. There should not be virtual monitoring of the host home service.
with no new guidance from DC Health for day, which is new information to us, are we required to consult with DC Health before making policy changes, or are we free to make our own policy based on guidance for businesses in DC, as Andy just suggested? Just want to be clear with what the expectations are for day. I would consult the mayor's order, which establishes what the floor is for all businesses operating in the district. To the extent a higher standard is established, you have to follow the higher standard. If it's silent, there's not a higher standard established. And
I would
so,
like to
yeah,
sorry, Director Reese. I just want to add that, if there is a somebody that wants to consult us, it's certainly not required, but if they would like to run something by us and ask if, what we think or our opinion, and see if, we are more than happy to do that. We're here to support in that way. And we do understand that, there was a lot of guidance for a long time. And now as we start to remove some, it's the kind of that feeling of having a guidance vacuum, well, where is it? Where's it coming from? Whereas before there was, that comfort or annoyance, I don't know which it is, but of having it there. And now that it's not there, it's like, okay, well, what do we do? And we do understand that that's a little bit of a transition, and we're happy to support in any way that we can. But I would say that, you should follow, whatever you did prior to COVID as far as making policy revisions and changes. If you worked with, DACL or DDS or whatever, body or other, organization you worked with to do that, you should continue to do that. And if DC Health can support, that process in any way, we're here to do that also.
There's been just a comment there may be DDA supported people for whom the question about mental health is relevant. So you were thinking that DDS might be aware. I'm not aware of additional resources. We have regular meetings with DBH. We have psychologists on staff here. And so, maybe Winslow could address, I think that the agency stays mindful of the mental health needs of the people we support, including some additional outreach that has been done during the pandemic. But I'll defer to Winslow on that.
Yeah, so what we've done is on individual case basis, we've consulted with our psychologists and they've offered recommendations to the person's actual team to put supports in place if we see that the person is experiencing some untoward effects of the public health emergency. I would also encourage people to go on the website that contains DBH's budget. Was in a call yesterday where the director was going through the particular enhancements to their budget that the mayor has afforded, but I do not recall and don't have in my notes specifics on those actual resources. I know that there are additional resources being put in place by DBH for all citizens, but I'm not specifically sure that our target population had a carve out of any sort within those resources. So, but it's a good question.
Director Reese, while we wait for questions, my colleague Andrea Cooker, if we could give a little bit of a brief reminder from the tele-ICAR for ICF providers, if that's okay.
Absolutely.
Great.
Hi, good afternoon, everyone. So thank you again to our providers for participating in the tele-ICAR for ICFs. This morning, we sent out the Survey Monkey for our providers to fill. And thank you to some of the providers that have already completed the survey and have sent it back. Please feel free to let us know, for you to comment, to make any recommendations, and anything that you think can help us to improve the process, as we'll continue to reach back out to you to schedule the next tele-ICAR for the rest of the ICFs.
So while there aren't questions, I'll just update, and the PowerPoint that gets posted on our website today will be corrected. So it won't be exactly what I went through. The one person who died on May the 31st had lived in an ICF, had COVID back in November, was asymptomatic and had recovered, but lived in an ICF. And so that data on the PowerPoint that gets posted after today's meeting will be updated to reflect those changes. So it would be 57, but it's still 36 confirmed COVID deaths.
Sorry, Director Reese, I got a text off to the side. I wanted to be clear when I was speaking on host homes. What I said was host home services cannot be provided virtually. So if hopefully I wasn't confusing people, I wasn't referring to monitoring of services in a host home. I was referring to the actual service provision that is host home.
And as I think I've indicated before, our staff will begin returning to the community to face-to-face visits with folks in the week of July 12th. We should check in with the Liberty staff to see how PCR will be done going forward.
Good afternoon. This is Kirk. I just wanted to chime in here. PCR will be returning to its full levels going forward, starting sometime in late summer. At this time, we're kind of combining some of our services. So respite's being combined into other services, as well as some of the DayHab groups and residential rehabilitation group services are going to be combined together. But those changes will be coming forward in an updated PCR policy that will be released in the next couple of months. So later in the summer, we will be going back to a full PCR schedule that will be remote and in person.
So there's a question, I'm not, oh, I see. Can you clarify expectations on vacations? What's the stance on vacations, especially for persons in an ICF? Is there guidance that speaks to this? Yes. I mean, there is update. Well, I shouldn't say anything because I'm not. The updated travel guidance is still there, right? And so I would consult the travel guidance and then the ICF guidance. But I'll leave it to, yeah, the travel guidance is still there. So I would look at the travel guidance and the ICF guidance that I think gives you all the information you need to make decisions about traveling for a vacation.
To add, just for vacations, our ICF guidance would treat that as an outing. So follow what that section says about that, and that in addition to the travel guidance. Thanks.
Because I'm pretty certain the travel guidance has different rules for vaccinated and unvaccinated people regarding quarantine when they return. Okay, it appears that we don't have any additional questions. Hope everyone has a good weekend. It's just occurring to me as we're having this that what I think I want to do is pull together a group of people and talk with you and hear from you about how we organize this going forward. I really like having this opportunity, but having something that is ongoing and kind of post-COVID um, uh, and useful for all stakeholders and us would be really helpful. So I'm going to see if I can reach out and pull together a group of people, I'll say in the next 2 weeks, so that we can start thinking about how this conversation gets structured moving forward. Because as I say, it's very helpful for me. And I think that it's a good resource for people. It's also wonderful for us to be able to hear from folks. So opportunities also for folks to hear from each other would be very helpful. As people said here, you know, a particular provider being able to set a good example, we have had opportunities in the past, and maybe we can structure it to have those more regularly and planfully of people being able to share information with each other. Someone is just saying, I just want to make certain that service coordinators and quality resource specialists are clear that there will be no further day service guidance and that any day providers are now under businesses.
So the adult day program guidance has been removed from the website. It's been gone for a couple of weeks now. And so they would follow the business guidance. That being said, you know, we, you know, at DC Health, we currently, you know, are evaluating the COVID situation. So within 2 or 3 months from now, it's identified that there is a particular problem in that setting, in adult daycare settings, and there tends to be outbreaks or things that, you know, can't be managed without reissuing guidance, then, you know, that's certainly something that DC Health would reevaluate at that time.
Absolutely. As things change, people will be updated. And that's, you know, I direct people here all the time, but the coronavirus.dc.gov website provides up to the day data. And that is what DC Health is looking at as they make their determinations about guidance. Okay, well, have a wonderful weekend, everyone, and I look forward to talking to people next week. Thank you.